Hello, everyone, and welcome to RMD, All Things Aesthetics and Wellness podcast with me, your host, Dr. Deborah Durst. So I have my team with me, and I'll let them say hello, since you probably know them by now.
Hello, everyone. My name is Farideh, and I'm a family nurse practitioner at RevitalyzeMD.
Hello, my name is Marissa Staten. I'm a medical esthetician and a laser technician. Thank you for having me.
So we're going to talk about IV therapy today. So this is one of our favorite topics. You know, we have an IV therapy lounge in the office, and we do IV therapy, and it's one of our favorite treatments. But it's like a comprehensive kind of ties, like it goes full circle for all of our other treatments, right? For aesthetics or wellness or hormone optimization, sexual wellness, like nothing's complete without IV therapy.
Patients always ask, what's an easy treatment I can do to boost my health or help my wellness overall? And I'm like, an IV. That's
right.
it.
Yeah.
And depending on what's going on with that patient, depends on which one I recommend, because there should be more than one IV offered.
Yes, absolutely. And there's so many different benefits to IV therapy. So, you know, the history of IV therapy with RevitalyzeMD or RMD is that way back I was in Vegas and I was at a conference, an A4M conference, anti-aging conference, and staying at the Plaza, which I always stayed at. And we needed a hangover IV. And here is Revive in the shopping center. So
the banana bag.
So I'm going to get an IV therapy. And while we did a video, and it was way back. And I said, bringing it back to Knoxville, because of course we needed it. And at that point, I hadn't even started the build out of the office yet that we're currently in. So I wanted to bring IV therapy back. And as I started to learn more and more about it, it is amazing the benefits that you can get from it. And then it just expands from there. But I did spend a year building out our IV therapy drips, because they're all formulated by me and by the office. And so we've fine-tuned them over, the last almost 3 years of being at this office location. So we put the drips together. We don't use kits. And so if you know IV therapy, there's some franchise opportunities, and they're opening up, and they have kits. So they don't really know the science behind it. There's not a physician that is specific to that office that has formulated it. They're getting kits from a third-party provider, and therefore they put they read the instructions, put the kits in, and infuse your drip.
And it's a one size fits all. And even offices that don't specialize just in IVs, they do it as like an add-on service, and it's just a one and done. And it doesn't matter who comes in the door. They're going to say, oh yeah, this IV is going to make you feel better. But it's a kit, and it's not customized to you. And it only really, it's not a bad thing. I mean, anytime you can get fluids and vitamins is great, but there's definitely an advantage and a benefit to have something that's customized to your needs, and then also based on what's going on. So sometimes an IV that's good for a hangover is great. Sometimes there's some for stress relief. Sometimes there's one for libido. Sometimes there's one for immunity and some
headache.
So your individual circumstance should always play a part, especially when you're getting some vitamins.
Post-marathons.
Post-marathons.
For our athletes, for muscle recovery.
Yeah. And again, they'll offer all of those different types of drip. Like there'll be an athletic drip, there'll be recovery, there'll be a headache. The issue is that if there's a third party involved, and they're not just actually putting those drips together, they can't customize it. And therefore you don't get the best and the most potent ingredients in there. And so we put the drips together in the office. We have all the individual ingredients. It's made the day that you come in. If we know you're coming in, or our regular patients and we know they're coming in, then we make it up and it's ready for you when you come in. But we have walk-ins available, but we're still making those drips up every day for you in particular. And so if somebody wants an adjustment, I want a little more vitamin C. I don't want the magnesium. It makes me tired. Anything that they don't want or they want a little more of, we know the science behind it, and we can therefore adjust and customize to your specific needs or desires within
Absolutely.
range, so
Absolutely.
yeah.
And then sometimes we have patients that call and they say, hey, I was out in whatever state and I saw a specialist out there and they put together this drip for me to treat this specific disease process or this chronic process. Can you guys do this? Can you help me with this? And we look at it and we can sit down and we can look at the science, we can look at the protocols, and we can make those adjustments in office with what we have. Because again, we are certified in IV therapy, and we have taken the time to learn the science to be able to customize those treatments, which is really cool.
Got to know the calculation. Got to be able to do an osmolarity and figure out the ingredients and if they're compatible. And, so that's all important. And we love doing that. Yep. We love pushing, the boundaries on what we can treat. And then again, we love when patients bring us education. And so if they bring something, and again, going back, there were kits or there were 4-hour functional medicine offices using IV therapy for amazing treatments. Again,
absolutely.
Autoimmune disease, anti-cancer as a tertiary provider, all kinds of stuff. And yet most patients don't want to do 4-hour infusions, and we don't have a functional medicine office where we're treating very sick patients or chronic illnesses.
Not yet, anyway.
Yeah, correct. Well, we want to keep them healthy and prevent all that. So we end up wanting to dummy it down to the point where we could actually do those same custom and great quality drips at a very short duration. Most people are about an hour in duration for the drips, maybe a little bit over if we're doing a glutathione add-on or we're doing another, bag of fluid. And so again, customizable, but most of it's in and out within an hour.
And then there's some that are more specific to DNA and cell repair. And those take a little bit longer because it's not as much fluid as the other IVs, but it can take a little bit longer just because of the side effects. So again, having an office that's knowledgeable, that looks at, the difference between a 1,000 milliliter bag and a 500 and goes, they're not going to run over the same time. That one's going to take 2 hours. This one's going to take an hour because they understand what's going on. I think that's really important when you're looking for an IV therapy place to go to for a provider that's providing those services.
Correct. And so one that she's talking about, it's kind of funny that you bring that up too. NADIV, NAD is a drip that you can do, but again, not offered very many places and not a lot of people that know about it, but you can turn back the clock with it. It's mitochondrial support, it's energy, it's brain, DNA support and repair and
cardiovascular benefits. I mean, the list goes on and on and on.
And what's so funny about it is, so that whole controversy of treatment with ivermectin and, Joe Rogan's podcast, and how he was talking about, I don't know that he did that on the podcast, but was talking about NADIV.
He did on his personal Instagram.
And his vitamin IV stuff. And then there was a doctor that actually went on to criticize and kind of dissect through. And it was a doctor that kind of went through everything that he said and had counterpoints, but his counterpoints weren't always the most informed as well, because he talked about vitamin D drips and how, that was inappropriate or something. Well, we don't do vitamin D drips. It's an oil-based product. So it was vitamin C that he should have actually been talking about, but the doctor that was criticizing didn't even know enough about IV therapy to use the right terminology.
We do those as injections only.
Yes, exactly.
Or oral.
And we do IV, we do IM, and we do oral, but we never do vitamin D IV. So he was incorrect in even his dissection and criticism of it. But further, he talked about NADIV, because I think Rogan did that
he did.
As part of his treatment. And the guy that was dissecting through and criticizing said, nobody should get NAD. There's no reason for it ever. So again, another uninformed doctor criticizing something that there is science in support of. So anyhow,
absolutely
interesting.
And lots of very interesting science and more that's coming out with some doctors and researchers that are a little bit more progressive that have been on podcasts talking, like Sinclair. It's very interesting, and there's a lot there, and it's excited to be part of an office that stays up with new research and cutting edge science, because this is something that we can offer, and it does make a huge difference. And it's helped me. It's helped patients. It's definitely something that I utilized during and after COVID.
Mm-hmm. Well, and then you can also, not only can you do it IV, but there's transdermal stuff you can do. There's NAD nasal spray, and we love the NAD nasal spray. We're getting a little off the topic of IV, but that's okay.
This is what happens when you have live conversations.
That's right. And NAD nasal spray is awesome, and it gets right into the blood-brain barrier. And so it's great for mitochondrial support, brain power, energy, and again, cell repair. And it's an amazing continuation after your IV therapy. So
absolutely.
And the science is changing all the time and progressing. And so again, what I find hard to support in traditional medicine is that closed-minded approach of whatever you didn't learn, you can't branch out and learn now. And so just because it's something a doctor hasn't heard of before, doesn't mean he needs to just blow that off. And in fact, even every dissection that he had, there were studies to support a lot of it, outside of the antibiotics. But anyhow, I wish that they would just actually look more at the science and progressive research. And you're right, Sinclair's doing it. And, a lot of oral precursors to NAD that he uses as well. So
absolutely
exciting stuff. You can use it for drug addiction. And we don't do drug addiction in the office, but we do NAD IV. And so again, it's something that you can use. It's amazing and has so many applications. So
absolutely. And then one of the other ones you brought up was glutathione. And that's another one, and there is a lot there. That's the mother of all antioxidants. So that is something that we frequently will add on after your IV bag. It doesn't play nice with a lot of things. Again, you have to have a provider that knows that and understands that to keep you safe. But glutathione is definitely one of my favorites and is extremely beneficial in decreasing free radicals in the body and oxidative stresses and inflammation. And I mean, the list goes on because it's an antioxidant. So there is lots out there to help with asthma and lungs. I mean, the resources that are out there and the information that is out there is unbelievable. So it's another one of those that is got a lot of science to back it, but a lot of people are not talking about it.
And it's not absorbed orally. You can actually give it liposomal and underneath the tongue. So therefore it bypasses and then it can be absorbed, but it's not absorbed orally. So the precursor to that is NAC, N-acetylcysteine, which then goes to form glutathione. So you can always do NAC and it forms glutathione, but we can do glutathione IM, but we do it IV. And again, amazing antioxidant. It helps your liver detox. You have 2 phases of detoxification in the liver. It helps phase 1 and phase 2 and gets those, fat soluble toxins that are stored in all our fat cells out. And it makes them water soluble and we excrete them.
Exactly.
And it brightens your skin, helps your
you'll hear them in like beauty bags. It's a frequent
Hollywood
ingredient in that.
Yeah, so there's all kinds of uses for that. And you can even come in and just get a shot, or if somebody's doing a beauty treatment or an aesthetic treatment, they can get a shot of glutathione when they're in the office. It's another way to quickly do it without an IV. But again, it can take 5 or 10 minutes if you're doing it just as like a beauty drip. Absolutely. Or we can do it as part of like our big, drips with lots of vitamins in it. And then again, like Farideh said, it doesn't play well with others. So we kind of got to put that in at the end or in an extra bag after. So
just kind of depends on what you're getting. So again, we're able to customize. Yes. So we have some patients that are extremely active, right? That are extremely active. And so they come in post trainings or post marathons and they get bags, and we're able to customize there and add some aminos and really customize for their needs as well, which is exciting for the office to be able to provide that, because it opens up who we see and who we treat. Again, we're in the business of wellness, so we're trying to keep everybody healthy, whether that's immune support or just giving them the best function their body can do based on what their lifestyle entails.
And all the water-soluble vitamins, which is why we said vitamin D doesn't go through an IV drip, because it's not water-soluble, it's fat-soluble. So fat-soluble vitamins are stored in the body, water-soluble are not, and usually excreted. Where vitamin C differs, if you're doing it in a high doses, it concentrates in the white blood cells. And so therefore the immune support is amazing with vitamin C. And, Myers drip way back, which is really just a syringe. It wasn't a drip, but it was a little syringe of vitamins.
Yeah.
That was a quick drip given, but it helped with allergies and headaches and, immune support, all kinds of things. And now we just do it in bigger doses and through an IV. But it concentrates in that white blood cells, supports it. So the immune support during everything that's went down over the last couple of years has been amazing. What I do find interesting is we tried to reach out at the beginning of COVID to see if any news channels wanted to cover immune support, IV therapy, or even vitamin D as immune support, and not one taker. So we had a lot of stuff on the news, but we had nothing about what we could do for immune support. So
even pre-COVID, it was, I would do a vitamin bag or a immune bag, which is a high dose vitamin C, pre-flu season, mid-flu season, post-flu season, just to stay healthy, just to give my body that boost it needs to prevent illness. So whenever we can prevent illness and sickness, and we can give our body what it needs to be able to handle that a little bit better, we should definitely be talking about that, especially when we see how important vitamin C and zinc and vitamin D and all of these vitamins really are, and nutrients and minerals are to help our immune system.
And the IVs also help just healing faster from more aggressive treatments, such as fractionated treatments, RF microneedling, Morpheus, 4D facelifts, microneedling in general. All of those treatments, and laser resurfacing, of course. And, I'm finding that the patients are healing faster, less downtime. When they do an IV at the same time.
That's a great point. Yep.
It's interesting. So I've seen where some offices, pre and post surgery, they're doing IV therapy. So you have some surgeons that are seeing the benefit, that are adding it into. Typically, we don't see that in traditional medicine. You go to a functional medicine or you go to a specialist. So you have some forward-thinking docs that are doing it pre-surgery or post-surgery for that healing benefit, or to put their patient in a better position pre-surgery.
Well, and that's definitely one of the uses, is that pre, peri, and post-operative for better healing. And so it's so important with that. And then, there's some peptides that we can use in addition to that.
Always. You can always add peptides. We can use,
now that you mentioned surgery, there's some other things. But again, even bariatric surgery. So if you have weight loss surgery, you don't even absorb the vitamins and minerals that you used to. And so getting this in a pre, a peri, and a post is so important. There is so many different uses. So, but then you got the vitamin C, you can get B, you get B complex, you get B12, you get magnesium, calcium. It just depends on the drips, and you can get other things in it.
You get Zofran. Just it kind of depends on what's going on.
Other medications if needed, if it's the, relief or a headache treatment. So there's all kinds of different ways. And again, 100% right to the cell, so it bypasses. And again, our GI layer is one cell layer thick. And so if we're eating unhealthy foods, we're not having bowel movements on a regular basis, a sign of toxicity in and of itself, then that food sits in the GI tract. It gets inflamed. We get things that leak into the GI tract and then cause inflammation, then later immune response. So again, all diseases
it all cascades, right?
And the GI tract and on inflammation, immune, all of that. So the bottom line is this bypasses your unhealthy GI tract, and probably on a good day we're absorbing 20 to 30% of what we take in orally. It's an unregulated market. Supplements aren't regulated. And so what you're getting 100% right to the cells. That helps with detox and immune support and energy and brain function and libido, recovery, all of the above. And so it's amazing. And again, people will feel great after. If anybody ever feels a little tired after, it's usually because you have a lot of toxins in your cell that it flushes out. And usually by the next day, they feel amazing as well. So
it's not abnormal for some people to feel not the best within that 24-hour period right after, if they do have a lot of toxins. So that is important to bring up, because we've had patients that have said, hey, my friend came and they felt amazing and I had a different response. And so it's education is really key, in making sure they that when you come in, you understand what drip you're getting, why we're getting it, what that response is going to be after, and what is normal and what's not normal.
And then there's actually, again, patients are very proactive when it comes to preventative health and regeneration and regenerative medicine. And so we even recently had a patient that requested that one ingredient be removed because it makes them drowsy, which I would agree. That's probably the case. But we just knew that we had to, take out another ingredient in addition to, because we want those in balance. So, just being able to customize to a patient's satisfaction, makes us happy, that we know, what to do. We can adjust it, the entire staff knows. And so it's fun. It's a very exciting
and our patients,
field of medicine.
Exactly. And our patients are extremely knowledgeable, and they are taking their health into their own hands. And so they're bringing in research. So I love it when patients come in and they bring in research about, after we talked, I looked up this ingredient, and did you know that it connects to this? And did you know that there's a study on this? And they bring those studies to us, which is exciting because sometimes there are things we haven't had a chance to look at yet or we haven't seen. So that opportunity to learn goes both ways.
And I'll tell you, when I was setting up the entire program from the beginning to end, and this is from like Palazzo on, as I started to learn about it, I just got more and more excited because there's so much you can do with it and so many benefits. And just learning that one thing leads to another, and then you can actually do this as a tertiary treatment for a really high dose. Like there's high dose vitamin C, and then there's like an ultra high dose that can be an adjunct to chemotherapy, help with side effects, help kill the cancer cells. And we had
improve white blood cell count.
Yeah. And I mean, just amazing. We never recommend somebody don't do chemo, but if somebody comes to us and wants an adjunct to help their chemo work better, there's some studies out there. And then recently we had a patient come to us. Again, it's been almost nonstop since we opened the office that we're always adding or doing something, learning something new, it's an adjunct to what we're already doing, so it fits perfectly. Yeah. So we implement it. But this was another time where we could stop and figure out if this protocol was something that we wanted to add and do for her, because she can't find anywhere else
exactly
around anyhow. There's cancer therapy, or cancer centers that are doing it, but she came to us with research articles in hand requesting, for us to do it. So,
and again, someone, when you have patients that are able to get things in other states, right? More progressive states that are more medically forward on functional medicine and looking at IVs, so it happens, right? We live in a little small town, right? Compared to New York or LA, or big little town, as they say. Yeah. So it's awesome to be able to do some of these protocols that are being done in bigger cities and look at that research and, like you said, apply it to those patients.
It's exciting. Fun and exciting because it's unlimited in what you can add on as long as the science is there and supports it and can be safely done. So, yeah. And then there's also another podcast we did on a lot of shots where we went into all the shots and, but the IV therapy we're talking about, again, there's 2 ways to get it outside of our office. And there's not a lot of offices that are actually doing what we're doing. In fact, I would have paid good money to go and not spend a year, setting it up and learning it.
With all your spreadsheets?
Yeah, with all my spreadsheets and all my calculations if something wasn't, if somebody had already had, a program set up to teach it. But really there's kits, which are, hey, put these in the bag and this works. And then there's 4-hour infusions for the functional medicine docs. And so what we did was take that longer infusion and change it to an osmolarity that can work over a shorter period of time, but you still get all the benefits of those high-powered, functional medicine drips. So it is unique. So you're not going to find IV therapy like you do at RevitalyzeMD anywhere else in town, and probably almost anywhere, ultimately. But, we still believe in the benefits. So again, if you're doing a place that's a franchise and IV drip, by all means, you're still getting vitamins IV.
Absolutely.
It's amazing. It's supportive. And I highly recommend it.
Absolutely. If you guys have any questions, we love having those questions in the comment area. So please ask us or your experiences.
So definitely share, hit the bell, and share any experiences you've had with IV therapy and anything with NAD. We would love to hear feedback about that. We love hearing positive feedback about the IV therapies, the vitamin C, the NAD especially.
Glutathione, that's another one.
If you haven't had your IV, give us a call.
Yes, yeah, by all
We'll get
means.
you set up.
Yeah, share with friends, give us a call, let us know your experiences, and again, let us know anything else you might want to hear or talk about. We're here to revitalize your look, your health, and
Your sex life.
They're catching on slowly. All right. Thanks, guys.